Hey everyone, my name's Katie, and today I'll be talking about AI in medical records and data management with Tiffany. So, how does AI work? What is AI? AI stands for artificial intelligence, and it uses algorithms, data, and powerful computers to help machines do tasks like learning, decision making, problem solving, seeing, and even understanding language. So, how would it be used? AI in medical records would use advanced algorithms and machine learning to process and analyze vast amounts of patient data. Basically, AI would be able to recognize patterns, make predictions, and provide recommendations based off that data that they analyze. To give an example, AI could quickly sort through a medical record to find relevant information that would help a doctor make a faster, more accurate decision or even diagnosis. It can also be used for the various of patient conditions and diagnoses like cancer, identifying risk for heart conditions, and even predicting complications with chronic diseases and creating personalized treatment plans. So, briefly just touching on this slide to show you all that there are other benefits that come with AI in electronic health records, like resource optimization and enhanced clinical decision support. So, just to go into some of the facts, the creation of AI dates actually all the way back to the 1950s, with the groundwork for it actually starting in the 1920s. The groundwork actually was by a Czech playwright, Karel Capek, released a science fiction play called Rosam's Universal Robots, which introduced the idea of artificial people. Then in later on, 1952, a computer scientist named Arthur Samuel also developed a program to play checkers, which was the first to ever learn a game independently. Then again, in 1950, John McCarthy also held a workshop at Dartmouth on artificial intelligence, which is the first word or first use of the word and how it came into popular usage. So going on to how proven AI is, it tends to, AI, by contrast, operates on probabilities and approximations. So it's not completely reliable and would need revision. Even with the vast amounts of data and processing power it has, AI models do not generate exact outcomes because they are trained on historical data and predict future behaviors based on patterns. Its acceptance is also somewhat flimsy, I would say. Research on the adoption of AI devices shows that users' attitudes, trust, and perceptions about technology can be improved by increasing transparency, compatibility, and reliability, also while simplifying tasks. Basically, factors that are important for reducing issues related to acceptance, like distrust, skepticism, and experience, would be supporting users with low intention to use and lower trust in AI infused systems. So, getting into the risk or side effects of AI, while it has many benefits, it could have data breaches with the increased digitization of medical records. It could lead to cybersecurity threats as well as increased unauthorized access, which could also lead to identity theft and privacy violations. There's also could be algorithmic errors. AI systems make mistakes. They potentially could lead to incorrect diagnosis, treatment plans, and could even jeopardize the patient's safety, depending on what they are relying on it for. There also can be bias. Depending on who produced the AI, biased outcomes can be trained into it and can be producing discriminatory outcomes and affecting certain patient populations and exacerbating the healthcare inequalities we already have. So, after that little spiel, I'll be going on to how we'll be implementing AI. Um, Basically, with medical records and data management, we'd be using it for data extraction and entry, which would it help extract information from medical documents and enter into electronic health records, which would be more efficient for doctors. It also could help with clinical decision support, where it analyzes patient data to assist doctors in making better clinical decisions. Predictive analytics, where it can predict, of course, health risks, suggestive preventative measures, as well as personalized treatment plans, and administrative tasks just like scheduling, billing, and reducing any administrative burdens of just having to sit down and write for hours. Um, so, can be used in hospitals, clinics, and research institutions. It enhances existing processes by improving data accuracy and efficiency. Could streamline administrative tasks, allowing healthcare providers to focus more on patient care. So, what would be adding and what would be replacing in this scenario? So, with addition to it, we would be adding advanced diagnostics, which would analyze complex medical images and genetic data to identify any health risk early on. Interoperability would improve because the communication between different healthcare systems would enhance due to the sharing of data and seamless data exchange. There would also be just real-time data processing, where AI can use process and analyze patient data in real time, providing immediate insights. Um, One of the replacements, well, rather than AI completely replacing existing processes, it would help enhance and streamline the existing processes that we have already set in place. Specifically, looking at like electronic health records and clinical decision support, AI would make EHRs more user friendly and efficient, as well as assisting and documenting patients' interactions more accurately and quickly. So, next we have Tiffany, who will finish off the presentation for y'all. Y'all enjoy.
Okay, hi, I'm Tiffany. So, for training and credentials, when introducing any new form of technology into a system, training and certifications will evidently become required to operate such technologies. While there's no universally recognized certification or training program to use AI in the healthcare system, most medical practices and hospitals require healthcare workers of all levels to complete some sort of training. So, training to use AI in application to electronic medical records may consist of training in the workplace, or other training programs might be third-party onboarding programs. So, for example, a company named Neurance, programs like this allow for physicians to be trained online to use their specific technology. And so, AI has become a specialization for some computer science majors, and many colleges now have developed a specific major in devotion to learning how to use AI. So, regulations: AI has been regulated under laws such as HIPAA and federal agencies such as the FDA. And through HIPAA, AI is regulated in terms of protecting patient data usage, transparency, and predicting future risks. So, in terms of protecting health information under HIPAA, healthcare organizations may only use patient information in certain instances, such as treatment, payment, and healthcare operations. And in using AI to interpret medical records or document patients' information, the system must be trained, which would mean they would have to use large numbers of protected health information in the process. This would require HIPAA authorization from each individual patient's data being used. So now we can look at the triple aim and how using AI affects each branch of this. So improving the health of populations. So some positive things that would come from this: using AI to assist with the analysis of large numbers of patient information. Certain trends in healthcare can be identified, therefore predicting future risks in population health, giving more time for health intervention. So AI may also it's recently been used to assist the production of medicine and new drug discoveries. A company such as AlphaFold has begun to use AI to predict protein structures, which will be used to better target diseases. So, some negatives from this: biases can occur in the algorithm when there's a lack of representation of genders and racial groups. So, underserved populations who do not have access to healthcare will likely be left out of the said sample, adding to pre existing health inequalities. So, per capita costs, some positives to this: using AI to enter patient data, scheduling appointments, it will free up healthcare professionals' time spent at the computer, furthermore reducing administrative costs. And using AI to analyze patient information to predict health risks and diseases. This can lead to catching illnesses at earlier stages when they're more manageable for the patient, both physically and financially. Some negatives to this: due to the complexity of AI and the technology as a whole, the estimated cost of to start up AI in electronic medical records would range from somewhere to $500,000 to $1 million. This would be different for what type of practice it was, but it is financially impractical for smaller practices. So, experience of care. Some positives might look like in using AI to assist in patient documentation, as said above. It will also allow for physicians to spend more time with patients building relationships. Um, AI technology would be able to cross compare singular patient symptoms to that of the system and the algorithm, and create more specialized plans for that specific patient. The reality that AI is it's just more systematic than humans. Many accidental mistakes may be eliminated from just documentation processes and things like that. And so, some negatives to this: while AI is able to tell anyone what they want to hear all of the time, some patients find this very um, in non-personal and might want to build a relationship with a doctor. An example of this would be the uh, patients being checked in by AI triage nurses, I guess you could say. And then patients might also be very untrusting of this new technology. Older populations might think their information is being sold and whatnot, just because they like a lack of information about the technology as a whole. So yeah, I hope you guys enjoyed. Thank you so much for watching.